Yeah, thanks for being on our show, Dr. Win. It's a pleasure to have you here today.
Thanks for having me, Tarina. I will have a lot of fun talking about my favorite topic, which is golf.
Yeah, we're all looking forward to that. Why don't you get started by telling our listeners a little bit about yourself?
Well, I have spent most of my life in Northern Virginia. We came over here from Vietnam, but since then I've been in Northern Virginia. I my original training was in anesthesia. I went to GW and did residency in anesthesia, and then I did additional training at the Mayo Clinic for my pain medicine fellowship. And I've been at Virginia Spine Institute for 18 years now.
Oh, wow.
I do a lot of their non-operative, non-surgical management and treatment of athletes and patients who are in a painful condition.
Right. And if you can elaborate a little bit more, on the details of your practice, what type of patients do you see, and what type of patient base you have?
So our practice is a multidisciplinary practice. We have multiple consultants at Virginia Spine Institute, and that's kind of what I train with at Mayo Clinic. We have here orthopedic spine, we have neurosurgeons, we have physiatrists, neurologists, and very specialized physical therapists. I What I do is I see patients and athletes who are in acute or in chronic painful conditions, and what I try to do is evaluate and come up with a plan on how to, one, get rid of the pain non-operatively, and two, kind of improve their overall function so that not only when they leave our practice they're in less pain or in no pain, but they're in better condition than when they started.
Yeah, no, it's great to have people like that in the area. So we'll get to our favorite topic, which is golfing. We see a lot of golfers with back problems in this area. If you can explain to our listeners from your perspective, what's the correlation between the two, golfing and back issues, how the two go hand in hand?
Yeah, so when before I started playing golf, I would watch golf on TV, and I go, oh, that's not a sport. That's you're swinging a club and you walk in, and the ball's tiny and there's no contact. How can that, how hard can that be? Well, in
Right.
reality, it's very hard. You're walking, a couple miles, you're carrying a heavy bag, and particularly with the golf and playing golf, you're doing a activity and a range of motion, and you're using muscles that you don't use everyday life. You're not
Mhm.
twisting the back, you're not hinging at the hips, you're not using shoulders and thoracic spine. So it's something that we're not used to. So when you go play golf, you're more prone to injury unless you work towards golfing exercises and staying out of pain.
Right. So what would you say to people who are in their 50s, 60s, 70s? A lot of them have back problems, some degenerative changes in their spine, and they are always in their struggle to trying to keep their spine healthy. But they also enjoy playing golf because obviously that's how they socially connect with people, and they just love playing golf. So how can they kind of maintain that balance between the two?
Yeah, so I think I kind of compare it to a car, right? When you have a
Right.
brand new car, you can just jump in it and go. But as the
Yeah.
car gets older, it needs a little bit more maintenance. You have to, keep the tires in shape. You have to keep it well oiled. You kind of turn on the engine and let it warm up. So that's the same thing with your body. As you get older, things get a little more degenerative. You have more degenerative discs. You have a little bit more arthritis in the spine and the hips, and you have tighter muscles. So you actually have to spend a little bit more time outside of playing golf itself to work on, improving the range of motion, strengthening some of the muscles around the joints, and that will most likely prevent you from having pain, but also playing better because you're going to have, better range of motion, and you're going to enjoy the game more when you play better and you're not in pain.
Right. Are there any alternate or parallel sports or activities that you recommend to your patients who are in that age group, and if they just like to golf all 7 days a week, something that they can mix up with on the other days?
Yeah, so that's what I do. I think racket sports are kind of somewhat similar to golf. I play tennis a lot on the days I don't play golf. It's a little bit more aerobic, so I can get my cardiac rehab in, if you will.
Right.
And you're using the shoulders, which you use in golf. You're twisting the lumbar area. You're twisting your hips, and so it's very similar. You're using the similar muscles, so that kind of keeps things in shape when when we're getting into the winter and you can't get out and play golf. You can go indoors and play tennis and keep the same type of movements going.
Yeah, yeah. But luckily these days, a lot of people also like move to the warmer, places to get their golf
True,
in.
true. Yeah, a lot of people
uh,
are snowbirding down to Florida and getting their golf in down there. So
yeah.
yes.
Yeah, so it's kind of nice that people like to do that. What are your thoughts on similarities between golfing and pickleball? I know that's something that this age group is picking up more and more, and
Yes.
it's kind of in similar lines.
Yes, I think there's lots of similarities in that. I mean, to go back to one of the topics I already broached, people underestimate pickleball. I've seen so many injuries now that pickleball is becoming, more popular. It's just short bursts back and forth, and you're bending a lot, and that causes a lot of knees and joints. And I've had a couple people, have acute back injuries from the pickleball. So again, back to the same focus: stretch, exercise, warm up, and that's how you prevent the injuries. People who underestimate just show up, a couple minutes before your pickleball game or before your golf and think you can go out there and play. That's when you're increasing your risk of injury.
Awesome. So where can our listeners reach you if they have any more questions or they are looking for a consultation with you?
They can always find me on Instagram. I think my Instagram
Yeah.
is at Dr. _ Nguyen, or find me at spinemd.com, which is our website.
Perfect. Yeah, we can go ahead, share your Instagram handle along with the episode notes. But thanks so much for giving us this time, Dr. Nguyen. It was a nice chat with you.
Thank you, Tarun. Thanks for having me.
Yeah, of course.